Hello and welcome. As we age, one of the most common health challenges we face is arthritis. Arthritis, particularly osteoarthritis, becomes more prevalent as we reach our 60s and beyond. This condition can lead to significant discomfort, affecting our ability to move freely and enjoy our daily activities. But the good news is, with the right strategies, we can manage joint pain and maintain a high quality of life. In today's video, we'll dive into the 7 risks associated with arthritis and explore how to control joint pain after 60. Whether you're already dealing with arthritis or want to prevent it, this information will help you make informed decisions to protect your joints and reduce discomfort. I'm Dr. Emily Tran, an expert in senior health and wellness, and I'm here to share practical advice for managing arthritis symptoms. Let's get started. 1. Decreased mobility and joint stiffness. One of the most common risks of arthritis is decreased mobility. Over time, the cartilage that cushions the joints wears down, causing stiffness, pain, and restricted movement. Why decreased mobility occurs? As arthritis progresses, it affects the flexibility of your joints. Cartilage is meant to act as a cushion between the bones, but when it deteriorates, bones can start rubbing against each other, causing inflammation, pain, and stiffness. This stiffening of the joints can make it difficult to perform everyday tasks such as walking, climbing stairs, or even getting out of bed. How to control decreased mobility and stiffness. Stretching and range of motion exercises. Incorporating daily stretching into your routine can help keep your joints flexible and improve mobility. Focus on gentle movements like knee extensions, ankle circles, and wrist stretches. Low-impact exercises. Activities such as swimming, walking, or cycling are excellent for keeping the joints moving without causing further stress or damage. They help maintain joint function and muscle strength. Additional tips. Apply heat or cold therapy to the affected areas to reduce stiffness. A warm bath or heating pad can help relax muscles and alleviate discomfort. Stay active throughout the day to prevent stiffness from setting in, but avoid overexerting yourself. 2. Increased risk of falls. With arthritis, the pain, stiffness, and lack of mobility can lead to an increased risk of falls, which is particularly dangerous for seniors. Why falls are more likely with arthritis? Joint pain can affect your balance and coordination. As the joints become stiffer and more painful, you might move more cautiously or avoid certain movements, which can throw off your balance and make you more prone to falls. How to prevent falls? Home modifications. Ensure your living space is fall-proof. Remove tripping hazards such as loose rugs, clutter, or electrical cords. Install grab bars in the bathroom and handrails on stairways to provide extra support. Balance and strength training. Exercises that improve balance and strengthen the muscles around your joints can help prevent falls. Activities like Tai Chi or specific balance exercises can improve stability. Proper footwear or supportive, non-slip shoes to provide stability and reduce the risk of tripping. Additional tips. Use walking aids like a cane or a walker if necessary. These can provide extra support and reduce the risk of falls. Keep your vision checked regularly, as poor eyesight can also contribute to falls. 3. Joint deformity and loss of function. Over time, arthritis can lead to joint deformities, especially in the fingers, knees, and hips. These deformities can significantly affect your daily activities and overall quality of life. Why joint deformity happens? As arthritis causes ongoing inflammation, it can lead to the destruction of cartilage, the growth of bone spurs, and changes in the structure of the joints. This can result in visible deformities, such as bony bumps or changes in the joint shape, which can affect movement. How to prevent joint deformity? Early intervention. It's crucial to start treatment early. This might include medication to reduce inflammation or using braces to protect the joints. Physical therapy. A physical therapist can guide you through exercises designed to improve joint function, maintain muscle strength, and prevent further deformities. Medication. Anti-inflammatory medications or disease-modifying treatments may be prescribed by your doctor to slow down the progression of joint damage. Additional tips. Manage weight. Carrying extra weight places additional stress on your joints, especially weight-bearing joints like the knees and hips. Maintaining a healthy weight by activity, whether changes, or even prolonged rest. How to manage chronic pain. Pain relievers. Over-the-counter medications like ibuprofen or acetaminophen can help manage mild pain. For more severe pain, your doctor may recommend prescription medications or topical treatments, such as creams or gels. Heat and cold therapy. Applying a heating pad or a cold compress can help reduce inflammation and alleviate pain in affected joints. Alternative therapies. Acupuncture, massage therapy, and other alternative treatments may also provide relief for arthritis pain. Additional tips. Practice relaxation techniques like meditation or deep breathing to help manage pain perception and reduce stress on your body. Consider speaking to a healthcare provider about joint injections or surgical options if pain becomes unmanageable. 5. Reduced quality of life and independence. As arthritis progresses, the cumulative effect of pain, stiffness, and joint deformity can lead to a decline in quality of life. You may find yourself becoming less active, isolated, or unable to participate in activities you once enjoyed. Why reduced quality of life happens? Chronic joint pain and limited mobility make everyday tasks, such as housework, shopping, and socializing, much more challenging. The frustration of dealing with constant pain can lead to depression and anxiety, further impacting your well-being. How to maintain quality of life. Stay active. Even small amounts of physical activity, like walking or gentle stretching, can help maintain mobility and reduce stiffness. Social engagement. Stay connected with family, friends, or community groups to avoid feelings of isolation. Socializing can also help boost your mood. Modify activities. Consider adapting activities to your ability level. You can still enjoy hobbies like reading, gardening, or arts and crafts without putting too much strain on your joints. Additional tips. Join support groups or online communities to share experiences and gain advice on managing arthritis. Focus on positive self-care practices, such as good nutrition, hydration, and relaxation, to enhance your well-being. 6. Increased risk of heart disease and other comorbidities. Arthritis, especially rheumatoid arthritis, is associated with an increased risk of heart disease and other comorbidities. The chronic inflammation that occurs with arthritis can affect other parts of the body, including the heart and blood vessels. Why arthritis increases the risk of heart disease. Inflammation in the joints often reflects inflammation in the body as a whole. Chronic inflammation can contribute to the buildup of plaque in the arteries, leading to atherosclerosis, hardening of the arteries, which increases the risk of heart disease and stroke. How to reduce the risk of heart disease. Healthy eating. Follow a heart-healthy diet rich in fruits, vegetables, lean proteins, and whole grains. Regular exercise. In addition to joint care, maintaining cardiovascular health is essential. Activities like walking or swimming can benefit both your joints and your heart. Medication management. If you have both arthritis and heart disease risk factors, working with your doctor to manage blood pressure, cholesterol, and blood sugar is vital. Additional tips. Regularly monitor blood pressure and cholesterol levels. Avoid smoking and limit alcohol consumption, as these factors can exacerbate both arthritis and heart disease. 7. Increased inflammation and swelling. Swelling in the joints is another common sign of arthritis. The inflammation in the joints may cause visible swelling, redness, and increased heat around the affected area. Why inflammation occurs? Inflammation is the body's natural response to injury or infection. However, in the case of arthritis, inflammation becomes chronic and persistent, leading to swelling, stiffness, and pain. The buildup of inflammatory markers in the bloodstream can exacerbate joint damage. How to control inflammation. Anti-inflammatory medications. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen can help reduce swelling and pain. Dietary changes. Incorporate foods with anti-inflammatory properties such as omega-3 fatty acids found in fish, turmeric, and ginger. Regular exercise. Moderate physical activity can help reduce joint inflammation and keep the body's inflammatory response in check. Additional tips. Use cold packs or ice therapy to reduce acute swelling in the joints. Elevate the affected joint to reduce swelling and improve circulation. So there you have it. These are the 7 risks of arthritis that you should be aware of after the age of 60. If you're experiencing any of these signs, it's crucial to take action early and manage your arthritis with the right strategies. Whether it's through lifestyle changes, physical activity, or working with a healthcare professional, you can control joint pain and continue to lead a fulfilling life. Thank you for watching this video. If you found this information helpful, don't forget to like and share it with your family and friends. Feel free to leave any questions or comments below. I'm always here to help. Wishing you good health and a pain-free life.